This interview was recorded at the Psychedelic Science 2025 in Denver, where we spoke with leading voices in psychedelic research, therapy, spirituality and policy. Dr. Jae Sevelius is a clinical psychologist and researcher whose work centers on gender diversity, trauma, and psychedelic healing. Their recent studies highlight how psychedelic therapy can offer both gender euphoria and dysphoria for trans and non-binary people. In this conversation, we explore what truly gender-affirming psychedelic care looks like and how therapists can create safe, inclusive settings for healing. When have you first encountered with psychedelics?
I was a rave kid of the 90s. So my first experience with psychedelics, I was probably 15 years old, taking mushrooms, in the park down the street from my house with friends. And I really experienced psychedelics in the rave culture kind of more in my 20s and really experienced that sense of community. I loved to dance, the music, the kind of celebration that psychedelics can bring to a setting like that is really my roots in psychedelics. And as I sort of transitioned out of the rave scene and went more into an academic role, psychedelics went more in a spiritual direction for me. So it was really very separate from my academic life. And so I studied with psychedelics more ceremonially for many years while I was pursuing my academic career. And it wasn't until 2016 when the California Institute for Integral Studies introduced their certificate training in psychedelic research and therapy that it really occurred to me that I could merge my interests in mental health and psychedelics in a way that, brought that relationship that I had with them above ground and into my work.
Can you explain to people who are not educated about psychedelics what was the difference from taking mushrooms at a rave and using psilocybin for healing?
I am a very big proponent of the idea that recreational or community or naturalistic use is healing and is therapeutic. So I don't see it as completely distinct. I think of it more as there are sets and settings that facilitate different types of experiences. And there are certainly different considerations when you're thinking about set and setting in a naturalistic or recreational environment than in a therapeutic environment. Like the types of intentions that you're setting are likely to be different. The way that you think about how your journey might progress or what kind of safety parameters you might want to put in place are really different. I wouldn't say really different, but you just have different considerations. But I found that psychedelics in the rave culture was incredibly healing, and it was where I found my queer identity and found queer community, and that sense of just celebrating being alive with other human beings and feeling like you're part of a tribe and you can really enjoy music and aesthetic experiences and all of these things. And I find that to be incredibly healing.
How would you convince your colleagues, like psychologists, who are less convinced about the therapeutic value of psychedelics? Like, why should they care?
I think that different colleagues that I've talked to about psychedelics have different questions and concerns. Some people really want to see the data. They really want to see evidence. They want to see the very rigorously conducted randomized controlled trials, which I understand, and I'm a scientist, by training, and appreciate that. I think we have incredible data already in that realm, and so if people have a chance to look at the data, I think they're really impressed and can be convinced that way. Some people are very concerned about the risks, and you really have to talk to people about what kind of safety data we have and adverse events. And to me, because we have literally millennia of data about how psychedelics have been used around the world in many cultures very safely, I'm convinced we have medicines that we prescribe to people whose safety data is, questionable, but there are risks that we're willing to take on board for the benefits that the medicines might be able to provide people. So I think, different psychologists and scientists have different questions about it, but I'm not a person who necessarily thinks that everybody needs to be an enthusiast. We just really mostly need to convince the policymakers that people deserve the autonomy and the liberty to make their own decisions about how to use these medicines safely in their own lives.
What kind of training a therapist needs to become a clinician who works with psychedelics?
Well, first and foremost, I would say they just need really good clinical training. So just good training in how to hold space and how to work with strong emotions. I think I'm a big believer in that facilitating psychedelic experiences it's really beneficial to have your own experiences. I know people feel different ways about that, but it's hard for me personally to imagine really understanding how to hold space for a psychedelic experience when you haven't had it yourself. So I'm a believer in personal experience, and I think it just comes down to doing your own work and really understanding what your own role is as a facilitator, so that you can be comfortable navigating the different boundary issues and space holding issues, things like touch and ethics that can come up when holding space in psychedelic sessions. So I'm a big believer in lifelong learning. I don't think you get one certificate and then you're a great therapist or you're a great psychedelic facilitator. And I also don't think that you necessarily need to be a psychotherapist to be a good psychedelic facilitator.
How can the LGBTQ community benefit from psychedelics?
Well, that's a great question. I think there are so many incredible benefits. We just published a study of naturalistic psychedelic experiences among LGBTQ people and documented all kinds of ways that queer communities are already using psychedelics and benefiting from them. And so I think in addition to some of the ways that we see the general population benefiting in terms of mental health, like depression, anxiety, trauma symptoms, I think that there's something really unique about the types of issues that queer and trans people struggle with, like internalized transphobia, internalized homophobia, shame, body dysphoria, and ways that people can benefit just from increased self-acceptance and really feeling that sense of like, my humanness transcends all of my identities, and I get to show up exactly the way that I am and express myself exactly the way that feels authentic to me. And for me personally, there's something very spiritual about that. There's something that's like, spirit, God, the universe, whatever you want to call it. In psychedelic experiences, it can almost be like a spiritual validation of your humanity and your perfection, however that shows up. And I think that's just so profound for communities that are marginalized and constantly told that they're wrong or bad for being who they are.
Did you witness any personal stories, like individuals who were stuck in their life because of gender or other related issues, and they could transform their lives with psychedelics?
Absolutely. One of my most beloved, admired friends, Gina Eichenbaum, who is a therapist in San Francisco, she tells a story publicly, so I feel okay sharing this publicly as well. It's published online, you can look it up. But she tells this really profound story of when she was young and really struggling with her trans identity, how she sought out an LSD facilitator to cure her of her transness. And she really wanted to do a high dose session and be done with this whole struggling with trans identity thing. And the facilitator agreed to, help cure her of her transness. And she did the high dose LSD session. And during her journey, she got an opportunity to talk to God. And she said something like, "What if I'm a woman?" And God said, "So what?" And something about that just really broke through for her. This like, wow, yeah, so what? Like, so I'm a woman, big deal. And having that validation from God, really, she came out from that experience really fully embracing her trans identity and going in with the intention to be cured of it. And so it speaks to me too of like, sometimes the medicine just knows exactly what we need, and we don't always know what to expect. We don't always get what we think we're going to get, but we get what we need.
Unintended consequence, right?
Yes.
I would like to believe that the therapists wanted this outcome in the first place.
I would like them to believe that too.
Otherwise it's kind of unethical,
yes.
Right?
Exactly. And this was many years ago when I think people thought that you could cure transness or cure, queerness. But yeah, I think today we look at that very differently.
What would you recommend to those people who are still considering to cure themselves from being gay or queer or trans?
I recommend finding community. I think there's this idea of the social cure, that belongingness and really seeing yourself in other people can cure a lot of mental health ailments. And so, I know that people often struggle with isolation and feeling like there's something wrong with them because of their queerness or transness. But finding queer community can be absolutely profoundly transformative. And I would say be open to the idea that you might just be perfect the way that you are.
In my country, Hungary, sometimes it's not very easy to find a therapist who is accepting and gender-affirming or has this kind of attitudes. Is it the same in the US still, or it's easy to find those therapists who are?
I would say it depends on where you are. I think different parts of the US, it's much, much harder. I live in New York and San Francisco, where it's probably the easiest to find queer affirming therapists. But I think, one of the beauties of the internet now is that, you can find online therapists. If you're in a rural area of the US, you can work with somebody who's licensed in your state, but maybe working in a more urban environment that tends to be a little more affirming. It can be easier. Sometimes you just really have to, there's some legwork involved. You kind of got to do your research and to find that person. But I think it is getting easier, and more queer people are becoming therapists. And I think it's nice when you can find a therapist that has a similar identity, if not the same.
Mm-hmm. So the psychedelic community perceives itself as very progressive and accepting and tolerant, but do you think that the LGBTQ community feels at home at conferences like this? Are they represented equally in this space? Or how do you see that?
That's interesting, because I've been having this conversation as I've been speaking on panels for queer and trans people throughout the week. I think we've really noticed that we've been able to carve out a space for ourselves at this conference and in these communities, but we're not necessarily integrated in the same way. I had gone to a session on couples therapy, and there was almost no acknowledgement of queer couples or couples in non-traditional relationship structures. And so just not having that acknowledgement of us and our relationship sort of integrated throughout conversations about therapy, especially when you're focused on things like relationships or sexuality, can feel marginalizing. And, one of the things that really surprised me when I first entered the more above ground psychedelic community, the more academic side of it, was the lack of focus on social justice issues and inclusion, because I had that assumption like, oh, it's psychedelic community, it's going to be so progressive and welcoming and inclusive, and it's not necessarily true. And now that there's sort of capitalist agendas involved in the psychedelic movement, I think then we really see a disconnect and some marginalizing forces in psychedelic communities, and so that can be challenging, I think, for us.
What would you recommend to service providers and researchers who are doing clinical trials to make those spaces more welcoming to LGBTQ people?
I would say, rather than think about like how can we design this clinical trial and then make it LGBT inclusive, I would say design an inclusive trial, like intentionally design a trial that aims to even oversample Black, Indigenous, and people of color and LGBT people. How do you center their needs? One of the things that we talk a lot about is that when you design programs and trials to include the most marginalized, everybody feels safer because you're really thinking about the needs of different communities, and you don't always know who you're talking to just by looking at them and what their needs might be in these ways. So one of the biggest things I say is hire people from those communities to help you design those trials. Make sure you have queer and trans psychiatrists on board, registered nurses, research coordinators. The whole team needs to be more diverse to reflect the needs of those communities and integrate them throughout the entire experience of participants and clients going through your programs and trials.
Do you think that those therapists who are treating LGBTQ people through psychedelic-assisted psychotherapy, do they need a specific training to do so, or anything like do they need any specific knowledge or skills?
Definitely, yeah. I would say. I mean, I think it's really about thinking about one's own identity and like how that factors into the therapeutic process. So like a queer therapist working with queer clients might need different things, different skills, different ways of like navigating self-disclosure and boundaries and community and ethical relationships and those sort of things. Whereas someone who's not queer working with queer communities might need to understand more about the language that queer people use, the different relationship structures, and also interrogate their own identity and their own relationship to queerness. So I think lifelong learning is critical, and everybody needs to reflect on where their own gaps and blind spots might be.
Can we say that there is a need for like specific services for queer people, or all services should be integrated and welcoming?
I think it's both. I've worked for many, many years in developing programs for trans and gender expansive folks in San Francisco and New York and other places. And I see the benefits of both. Sometimes, you can take generalized services, make them inclusive, but then I think it is important to carve out specific spaces, even within those broader service provider networks, to give people kind of a safe, contained space where they get to interact with people from their own community, create their own programming. And so I think it's really special to have both. I mean, everyone should be able to access, say, a primary care provider. You should be able to go to any primary care provider and get good care regardless of your identities. But, that's also not always the case. And sometimes it's nice to also, have maybe some kind of queer trans health service or health education program within a larger system.
You did some research on the psychedelic experiences of LGBTQ people, right?
Yes.
So how are those experiences specific? Do they have anything that makes them different from other experiences?
Yeah, I think so, just because there's that reflecting on the ways that they might have experienced trauma related to their identities. And so things like family rejection or being misgendered or having to come out to parents. Like, kids don't generally have to come out as straight to their parents, but when kids come out as queer, sometimes it can create a rupture, and that sense of not being fully accepted for who you are can be really traumatizing. And so often I think the themes that come up in the psychedelic experiences of queer and trans people. There's a lot of common themes, and I think they can be really different. Body dysphoria among trans people is something that a lot of our participants talked about, where some participants talked about working with mirrors during a psychedelic experience, so really integrating what they look like, what their bodies look like, and really learning how to love that reflection in the mirror through working with psychedelics. And that might be an experience that would benefit all of us, but I think it's, uniquely something that comes up a lot for trans folks in particular.
Many queer people are marginalized and socially excluded, and psychedelic-assisted therapy is still very expensive. How can we make sure that more people have access to this form of treatment?
That's a really, really great question, and I think in a lot of ways it is the big question, not just for queer and trans people, but all marginalized people and people who really need these treatments. Like, I think about people who, with post-incarceration syndrome, people have interacted with the carceral systems, especially here in the US, people of color, people with severe mental illness. And I think embedding psychedelics in a mental health care system that's already very broken here in the US is a very, very challenging prospect. But I think that when we think about ways to make these medicines more accessible, more cost-effective, I'm very interested in group models, not just because they're cost-effective, but also because they have something different to offer, especially marginalized communities. I'm also very passionate about peer support and thinking about how these medicines can be used safely and how the benefits can be optimized when psychedelics are used in community, which is the most common way that they're used. And so how can we work together as mental health providers, therapists, doctors, to help communities understand how to optimize the benefits when they're using these medicines in naturalistic settings, which are much more accessible at this point.
So the main theme of this conference is integration. Can you tell us why integration is so important?
We've talked a lot this week about how people can have very profound experiences on psychedelics, very profound insights, profound realizations. And when you go back into the systems and the relationships, the environments that your day-to-day life consists of, it can be very, very easy to fall back into the same patterns and to not know how those insights can be reflected in your day-to-day life. And so for me, integration is really about okay, you had this profound experience, you had this profound insight. What does this mean when you're stressed out, your kid is screaming on a Monday, you can't get them in the car to go to school, you need to be at work that day and deal with the systemic oppression of academia, in my case. And how do I bring that insight into the patterns that play out in my day-to-day life? Because that is very, very rigidly ingrained in us, these patterns. They're very difficult to break, and you can have profound insights and still not be able to break the patterns in your day-to-day life. So for me, it's really about bringing that back into the world that we live in.
It's a turbulent period in the history of the US right now, and there's growing polarization and racism and homophobia and transphobia. Do you think psychedelics can help or contribute to healing this society?
I want to think that. And I think that psychedelics have a lot to offer in terms of helping us to survive this environment and what we're going through. But something that we've seen is that psychedelics doesn't necessarily cure people of being transphobic or being homophobic. We see lots of people who are very openly doing psychedelics. I can think of one very rich, very famous person right off the top of my mind who is famous for doing psychedelics and who is an incredibly destructive and transphobic human being. So psychedelics in and of themselves don't cure anybody of anything. I always go back to Stan Grof's kind of non-specific amplifier idea, and that really resonates with me. Even though we want to think that psychedelics open everybody up to thinking about our humanity and how we're all connected, and it makes people more loving and more grounded, it's just not always the case.
Okay, so if not the hippy-dippy psychedelics, then what gives you hope about the future?
What gives me hope is my communities. You know, I see we're never going to go away. You know, they can pretend like we don't exist. They can enact policies to limit our care. They can put us in jails and prisons, but we will never be erased. We've been here since the beginning of time, and we will always be here. And I know that my ancestors and transcestors struggled just like we're struggling, and they emerged, and we're all very magical beings that have survived for millennia, and we will continue to be. And we can bring love and connection and beautiful things to this life despite what happens around us.